All right. So, hi, everyone. Thank you for joining. My name is Caitlin Miller, and I'm the current Heart Corps member at the Iowa Heart Foundation. The Iowa Heart Foundation is a nonprofit organization started by the physicians at the Iowa Heart Center about 30 years ago, and we're focused on heart health education and heart disease prevention in the state of Iowa. I'm very happy to introduce two speakers from Special Olympics Iowa. Krista Smith, who is the Director of Unified Programs, and Gustavo Romero, a health messenger, and they will both be discussing inclusive health and their experiences with Special Olympics Iowa. So I will hand it over to them.
Awesome. Yeah, I am Krista with Special Olympics, as Caitlin mentioned.
I'm Gustavo Romero. I'm a global messenger and also an athlete.
So today, oops, make sure it's going to let me change slides here. There we go. Are you able to see the slide change? Awesome. Okay, so before I kind of get into what our health programs look like and why we're part of this webinar, I like to start with our mission of what Special Olympics is and how this all plays into what we do on a day-to-day basis. So we are a competitive sports organization who provides year-round sports training and athletic competitions in 23 sports for individuals with intellectual disabilities by giving them continuing opportunities to develop physical fitness, demonstrate courage, experience joy, participate in a sharing of gifts, skills, and friendships. So I like to explain it as all of those benefits of a sport, outside of just playing a sport. And today we'll specifically be focusing on that physical fitness piece and why that is so important for our organization and for our athletes. So a little background on us and our athletes. We have Special Olympics teams in all 99 counties. We have over 327 teams. We have 9,100 plus athletes and over 1,000 unified partners. So a unified partner is an individual without a disability who competes and who practices and competes on the same team as our athletes. Athletes age range from 8 to 80 plus. I believe our oldest athlete is 82, I want to say. We have over 20,000 volunteers to run 140 plus competitions. So we have competitions. The ones that stick out to people when they hear Special Olympics Iowa is Summer Games, which is one of our largest state tournaments. But we have many more competitions. And then we have 130 plus Unified Champion schools. So that is our school partnership program with preschools all the way through colleges throughout the state. So here are our state tournaments. I won't necessarily read through each sport offered, but Summer Games is our largest state tournament in Ames. That's typically around Memorial Day weekend. State softball we have coming up in a few weeks in Grimes. That's a standalone state tournament. Fall Classic is in West Des Moines in September. Bowling is one of our most popular sports. It might be the most popular sport. And so there are area competitions and state competitions, and that one is split up into 4 locations since the bowling alley can only hold a certain amount of bowlers. Winter Games is in Dubuque in January, so some of those winter sports. And then Spring Classic is in March in Iowa City. In unified sports, you've heard me mention, unified, what does that mean? So that is people with and without intellectual disabilities on the same team. So this picture here is the University of Iowa's unified basketball team. And so I like to point out that, unified as a unified partner, that is different than just a volunteer at our events. So a volunteer, for example, at a basketball game might be the one running the clock or taking stats. As a unified partner, that person is practicing, they're doing weekly practices, they're competing, they're in the same uniform. And so our school partnership program really promotes unified sports, and that model leads to new friendships, improved self-esteem, all those awesome things that just come with being part of something. So here's that Unified Champion Schools program. Again, it's preschools all the way through college, and these schools do things in 3 components. So unified sports is perhaps the main one, as we're a sports organization. But the 2 other things that really make this program so effective is inclusive youth leadership, which are opportunities in schools for students of all abilities to be part of clubs or student council, just to have the same opportunities as their peers. And then whole school engagement is any opportunity where the school is seeing and acknowledging, oh, hey, this is happening in our school. It might be Inclusion Week, for example, where a school will celebrate. This is a nationwide celebration where schools are teaching, what does it mean to have an intellectual disability? There might be some unified games going on, just those events that get the whole school involved. And then fundraising events, this is a piece of Special Olympics. You heard me say we have 140 competitions, more than 140, and we don't charge athletes to come to our competitions. And so for us to do that, we have a whole fundraising team at our state office. So these are a few of our most popular fundraisers. And if you live in any communities that have these restaurants, you might see us out. But Butter Burgers and Badges is with Culver's. Tip a Cop is with Texas Roadhouse, and then Cop on a Rooftop is with Dunkin' Donuts. So those are where we partner with these different restaurants and have the law enforcement involved to fundraise and just spread awareness about Special Olympics, and gives the community a chance to meet athletes who are there helping out. And then Polar Plunges might be our most popular fundraiser. I know Gustavo has done the Polar Plunge before. So that's where teams can raise money and plunge, whether it's a pool or a lake or our mobile plunge unit. And then special programs, these are kind of in support of our mission in our sports, which is what we do every day. Young Athletes is a program for 2 to 7-year-olds. To do our competition sports, athletes have to be 8 years old. So the Young Athletes program is that, sport introduction program, just giving them the opportunity to practice kicking a ball or using some of those foundational skills that sports require. Unified Sports Days are a non-competitive event where we have different stations set up. It's typically hosted by a college. So you'll see in that bottom picture, it's the University of Iowa, where their students will put stations together that are sport related. And it's just a fun day to have, different unified sports going on with the college students. And then Motor Activity Training Program is for athletes with more severe and profound disabilities. You'll see in that bottom right picture, they're playing wheelchair basketball, and they each have a one-on-one support to assist them with passing the ball. The ball being used is able to be gripped a little bit easier than a standard basketball. So those events take place all over the state as well. Then athlete leadership, before I introduce you to Gustavo here and give him a chance to talk. Athlete leadership is also a program we have at Special Olympics. So global messengers and health messengers are athletes who are essentially educated and trained on being spokespeople for Special Olympics Iowa. So with that, I'm going to let Gustavo share a little bit about himself and his involvement. So I'll ask you a few questions, Gustavo, and let you share with everyone here. How did you get involved with Special Olympics?
I was in middle school. I came 2004, and one of my teachers said, "Hey, you should try this," and I said, "Let's do it." And I absolutely enjoy every single second of it. And I've been with Special Olympics for 20 plus years, and best decision ever.
I love that. What do you like about being an athlete leader?
Has that sorry, it gives me that chance to meet new people, motivate them, and make them feel that they belong anywhere in the world, and make them feel that they're important as much as I am.
Absolutely. What is your favorite memory with Special Olympics?
Um, Winning my first gold medal in running the 800.
That's awesome. And what would you say the impact of Special Olympics in your life has been?
Um, it, it has turned me into a better person, give me a better perspective in life, and um, discover who I really am and what I'm capable of doing.
Awesome. So these are a few pictures on the slide too of Gustavo and his involvement. He is involved, I think, in every aspect of Special Olympics. I know I've seen you at a Unified Sports Day. You're an athlete leader. Of course, our competitions. And Gustavo was able to go to the Dream Ride experience. You want to show him that medal you got from there? So that's an event. Do you want to share a little bit about what that event was?
The event is amazing. I will recommend it to go again. Down there, the people are down to earth, the nicest people that you will meet. It is really nice. You get involved with a lot of what they do for fun, and it's enjoyable.
So they all have their fancy cars, and you got to
Yeah,
ride
I
in
did.
one of them. Gustavo has been well versed in Special Olympics. And now switching gears a little bit, why we're here today. So you've heard about our organization. You've met Gustavo and myself and kind of heard about our roles. But what we want to talk about today is our health programming. So that is one aspect of Special Olympics I haven't touched on yet. But I want to start at the basics with intellectual disabilities. So those are the athletes that we serve. And so here's a couple definitions on the screen of what an intellectual disability is. And so that is significant limitations in both intellectual functioning and adaptive behavior that originates before age 18. And so an intellectual disability, or somebody who has an intellectual disability, these are people that you likely know and see. You might not know they have an intellectual disability, but these could be your neighbors, family members, coworkers, students, people in your community. And so, I think about myself and being involved in all of these aspects, and something that allows me to work and to travel for my job and for personal reasons is health and being in good health, and just having the knowledge about how I should fuel my body, why should I exercise, which leads me to some health disparities that sometimes our population does see. So these numbers are from Special Olympics North America, so I won't dive too deeply into them since it's not just Iowa specific. But a couple key ones that I like to point out is people with intellectual disabilities are 5 times more likely to have diabetes and 2 times more likely to experience cardiovascular disease or asthma. So here is an example. This is kind of switching gears from those two, diabetes or cardiovascular disease, but speaking in that health realm. So let's say, for example, I am the opposite person and I'm passing the basketball to this player. And so it looks like from the picture, oh, I'm going to pass the basketball to him. He's going to take the basketball and he's going to go make the shot at the end of the court. What people might not know, if I have an intellectual disability, maybe they can't physically see my disability, but it's there. Maybe I have impaired vision. So keep that picture in mind. Let's move on to this slide. This is a scenario. I should have had it related to basketball, but say there's a 35-year-old who goes to the eye doctor every year. She's not able to participate in the eye exam because she can't read the letters on the chart or can't recognize the letters on the chart. The optometrist doesn't know how to provide her with an alternate test. So she is considered legally blind, never provided eyeglasses to see. And so that could be a case, where the individual maybe just wasn't able to read the letters. And so an alternate example could be shapes or just something they're able to recognize. So I like to start with this scenario as a way to get people thinking, in the medical world, sometimes your patients just need a different way to do an exam. And sometimes that takes, taking an extra few minutes to get to know who they are as a patient, maybe a little bit about their disability. Sometimes they're able to communicate, hey, I'm not able to read, but I can do this. And so they can work with the doctor to figure out how they can still accomplish the medical examination, just in a way that they're able to do it. But what we do see, and this is national, Special Olympics North America has recognized, is sometimes it is that doesn't take place always in appointments. And so the solution for that is inclusive health, and that is something where Special Olympics can play a role in. So we obviously are not medical professionals. We are running sports, and that's what we do day to day. But what we can do as Special Olympics is help educate the importance of just including athletes and everybody in their appointment and in their care. And so the goal of inclusive health is to improve the health outcomes for people with intellectual disabilities. So those data points I shared a few slides ago, improve physical and social, emotional well-being of people with intellectual disabilities, ensuring they have access to the healthcare and services. And I like to add in there also the education piece, and improving health access by trained workforce who's able to understand what it means to have an intellectual disability or how to communicate with someone with an intellectual disability. So this again is some national data from Special Olympics North America. So we have health programs. We call it Healthy Athletes, which I'll get to in the next slide or two, but we've offered over 1 million health screenings across the country. And there's over 53,000 athletes that participate in year-round wellness programming. And then we have 980 health leaders. So going back a few slides when I talked about athlete leadership, a relatively new aspect to our leadership program is health messengers. And that's where we got to know Caitlin and Leslie with the Iowa Heart Foundation in utilizing our athlete leaders like Gustavo, who is going and spreading the word of Special Olympics, but in that health world. So how can we also share what Special Olympics is, what intellectual disabilities are to medical professionals and people in the medical field, as well as fellow athletes, and why is it important to exercise and something as simple as stretching, that educational piece. So kind of before I get to asking Gustavo some more questions here, at Special Olympics, we kind of focus on these 4 pillars when we are in our health programming. So prevention are things such as young athletes, that program for 2 to 7-year-olds, just getting kids moving young, even if they have an intellectual disability. Sometimes parents might receive a diagnosis and they might think, oh, my son can't go play t-ball with his peers because he has difficulty walking. No, that's not the case. And we have some awesome programming to get them involved and show them how that can be done. Fitness opportunities, we'll talk a little bit more about that. Assessment, that is Healthy Athletes programming, which I'll talk about on the next slide. I should have had that before. Training, such as what we're doing today, just talking about our organization, our athletes. And then advocating. Gustavo here is one of our athlete leaders who talks about Special Olympics, but there's some athletes and they might be on Gustavo's team who maybe are nonverbal and not able to advocate for themselves. And so that's where we come in to help kind of spread the knowledge of Special Olympics and just the importance of how to include people of all abilities in everyday life, whether that is the medical field, whether that's sports, jobs, everything. So our Healthy Athletes program is designed to help Special Olympics athletes improve health and fitness. And so we partner with medical professionals in all of these disciplines. And this is something that takes place at our state tournaments. So Summer Games, Spring Classic in Iowa City, and Fall Classic in West Des Moines is where we have them come in. They'll set up stations and do free screenings. So this does not replace their medical care. It's just an additional opportunity, and athletes can choose which stations to go around to. Gustavo, do you want to share maybe about your experience at Healthy Athletes and what station you've been to?
Yes. They teach you how to brush your teeth and how many times you have to do it. For good hygiene, how many times a day. Make sure you take a shower. And they do it in the most nicest possibly way. They know what they're doing, but yeah, I enjoyed when I first started. That's what I did, and very wise decision.
Yeah, athletes have the opportunity to go take place in all of these screenings. It's kind of set up as an exhibit almost, where they're
Mhm.
able to go around and go to the Special Smiles station and have their teeth checked. And if at any of these stations, if there's something that's flagged as, maybe needing further attention, they will get referred to their dentist, or if they don't have a dentist, to a dentist in their community where they can get those looked at further. So I guess before I go into these next two slides, Gustavo, I want to ask, what is your advice for doctors or medical professionals to include patients of all abilities in their care or appointment?
Um, Make sure that you acknowledge the person, the patient, the athlete that you're studying, or you take tests with them, but make sure that you include them because they're the main person who's going to receive the care instead of the parents, and make them feel that they belong.
Mhm. Absolutely. And so something we talk about quite a bit at Special Olympics is, if you've never met somebody who has a disability, they are a person before they are their disability. And so something as simple as, a patient coming in that has an intellectual disability, acknowledging, oh, hi, what's your name? Nice to meet you. And really making sure they're included in their care. And that could go for dentistry, that could go for, nutrition, just taking a couple minutes to get to know who the person is, before you dive into, oh, hey, here's what we need to focus on for diabetes, and here's what it means, because that's all, big words and can sound scary to anybody. So really taking time just to, yeah, as Gustavo said, acknowledge who they are as a person, including them in their care, and just using words that we're all able to understand, since we're not doctors and don't always know what certain things are. So a couple of things that Special Olympics does, I've mentioned we're not doctors, we're not able to provide these screenings or this referral care for our athletes, but we can do some activities that partner with different medical professionals and different medical organizations. And so Healthy Communities is expanding access to healthcare and resources for our athletes. And so that is partnering with different organizations, potentially doctor offices. The education piece is what we're doing now. We do quite a few lunch and learns with different colleges. So Des Moines University, for example, so our future medical students, just what we're doing now, talking about our organization and how you can have an individual with a disability feel included in their care, because that can be, something different. I didn't go to medical school, but there maybe isn't a huge class on what is that, how do you talk to them, and so Healthy Communities is where we can just educate and share that it doesn't have to be anything complex. It can be as simple as getting to know them, and talking to their parents and caregivers and asking them, what's the best way for Gustavo to feel included in his care plan? Those are questions that are definitely okay to ask. And so also through Healthy Communities at Special Olympics, we focus on health programming through all of our stuff. So for Gustavo to be able to do basketball and track, it's important for him to be active. So what are some of your favorite ways to exercise?
I like biking long distance. I like to ride 60 miles a day. Not every day, but in the weekends. But just um, keep your mind busy. If you're determined, let's do it, and then go for it.
And then fitness, that plays in perfectly to our fitness programming. So this is something that we at Special Olympics offer, just so athletes are able to, first of all, understand the importance of maintaining fitness and the balanced diet, heart health, so they're able to compete until they're 82 years old, like some of our athletes are. And so we encourage them to pursue a life of fitness through physical activity. Not everyone bikes 60 miles like Gustavo, but activities such as that, or walking, some of those fitness activities that you can do without needing a gym membership. Nutrition is a big one, and educating, what does a well-balanced diet look like? What are some things that are good to eat before a competition? What are some snacks that are good to eat that, help your heart health, for example? Hydration. So we have different fitness challenges that we roll out at Special Olympics, but also have different resources that kind of touch on all these aspects of overall well-being and fitness. So how can you be part of our inclusive health movement? There's a variety of ways. That could be volunteering with healthy athletes as folks who have an interest in the medical world, or just volunteering at events in general, being part of the referral network. We have had, so every year for our Global Messengers, we have a conference where we partnered with the Iowa Heart Foundation to provide education to all of our athlete leaders on heart health and why is it important to exercise. It's not just so you can be the best basketball player. Yeah, that's awesome, but what is that doing for your heart, and how does that help your longevity of your life? And so those are some ways that we can partner with different organizations and just make it a more inclusive health world for everybody. So now, kind of to wrap up, Special Olympics eliminates barriers, promotes inclusion, encourages healthy living, and fosters lifelong friendships. And so that plays into all of the programs that we offer, but especially health. So we'll now have a few minutes if there are any questions.
Yeah, thank you guys so much. Chat is open for anyone who has any questions. I do have one to start off, and this is for either of you, both of you. What are some good ways to show support every month, not even just like Disability Pride Month at Special Olympics or anything that's similar to it?
Well, that's a great question. Want me to start with that one?
Yes.
I would say, are you saying support as in like specific to health or kind of overall?
Overall.
I would say kind of going back to the basics. I know I'm repeating myself here, but acknowledging athletes, and I use the word athletes, acknowledging community members with a disability, as a person before they are their disability or before they're a Special Olympics athlete. And so first of all, kind of creating that friendship or that acknowledgement. And then from there, learning about who they are. Oh, you're Gustavo. What do you have going on, Gustavo? Oh, you have a competition. I'm going to go cheer you on at your next track meet. So yeah, just taking a few moments to get to know who they are. And I think people would be surprised. There's just as many differences between disability groups as there are between myself and an individual with a disability. So no two disabilities are the same, even if it's the same. Do you have anything to add on to that, Gustavo?
I do. I just give me 1 second.
That's okay.
Yeah, you're good.
Make them feel that they got purpose in life, because if, like, I will put myself in an example as like, if I don't give someone a chance to better themselves, how are they going to prosper? And um and I think that everybody deserves a chance in life. That's what I think, but I could be completely wrong, but that's what I came up with.
Yeah. Super helpful, thank you. And then I did have one more question, or I guess two actually. The first one is, what are easy ways for athletes or individuals to start getting active? Like I know you had mentioned maybe walking earlier, something without a gym membership, so I didn't know if you had any experience with easy ways for people to, start.
See, hey, if you walk with me, um I'll buy you a snack. I know that's not that right answer, but and they might be motivated just a little bit more, so they have a good class to go to, and that's how you start it, and you can go from there. But
Absolutely. And one thing that Gustavo does an awesome job with being an athlete leader with his team, and I know with other athletes across the state, is that motivation piece. And so, as I said, not every athlete bikes 60 miles a day, or not daily, but pretty often you do that. But Gustavo will be motivating to the other athletes on his team. And so instead of, pointing out, hey, you need to get exercise so you can be the best athlete you can be, it's, hey, it's really good if we go for a bike ride and here's what it helps with and here's how it can benefit our sport. So why don't you come with me and let's go for a walk, let's go for a bike ride. And yeah, we do find that snacks are always a great incentive, which through our health programs we are able to educate and provide healthy snacks for our athletes. So maybe it's things such as fruit or a cheese stick instead of cookies before doing fitness activities.
That's
So I
awesome.
guess
And
did
then,
that answer your question?
yes, it totally did. Thank
I
you.
guess to kind of wrap it up, I would say more kind of functional ways to do fitness. So yeah, walking, biking, um, those a lot of our fitness challenges revolve around that. Or I know one we just did was, challenging yourself to eat 5 fruits and vegetables a day, getting that full serving. So we have some calendars with different fitness challenges like that, that I want to say are simple, but they're really not. So it takes that extra effort and motivation to choose the healthy option and to choose to go for a walk instead of watching a TV show or something.
Yeah, I know that's definitely a hard habit to get into, so that is really helpful to hear. And then I think my last question would be if anyone is interested in getting involved and is maybe a little hesitant or they don't know what to do and how to get, in contact with you guys, what would be the best way to.
Absolutely. Which I think I have our website on the next slide. Our website is an awesome place to go to see all that we have going on with Special Olympics. So soiowa.org is our website. We have events going on around the whole state. And so that could be, an athletic event, or it could be events such as the Unified Sports Days or health related events, lunch and learns with colleges. So I would first direct you to our website. If I can get to our next slide here, I don't know why it's giving me a hard time. There we go. So I work with our unified programs and our school-based programs. So my email is on here, and then Sydney works with our health programs and our state competitions. And so feel free to reach out to either of us, or the generic email on our website as well. And we'd love to have you guys involved.
Well, thank you so much. Those were all the questions I had. Do you guys have any last things you want to add in before we close out the webinar?
Anything we forgot?
Not to my knowledge. I just want to say thank you very much for your time. Very appreciative, and I hope we to hear from you again at some point, and but go ahead.
Absolutely. Yeah. Yeah. Just thank you for allowing us to share about Special Olympics and our health programming, and how we can just make it a more inclusive world for everybody.
Yeah. Well, thank you guys so much for attending and speaking to us. Keep an eye on our social media page for our next webinar, and we'll get this closed out. So thank you guys so much.
Awesome. Thank you.